Hello, wonderful attendees. I'm your host, Dalvinder Kaur from Lovely Professional University. Get ready to dive into today's topic, that is mechanism of injury and recent advances in management. Before we proceed further, allow me to introduce the experts of the day. Dr. Zaki Anwar, Professor, Department of Physiotherapy, Lovely Professional University. With over 20 years of professional experience in both the clinical and academic settings, Dr. Anwar has held esteemed positions, including professor and head of the lab at Lovely Professional University. His expertise has been recognized at national seminars, workshops, and conferences. So now I would like to introduce the admission nominee also in this webinar, Mr. Pankaj Vij, Head Department of Tie-Ups, Division of Admission, Lovely Professional University. He is having 18 years of experience in multiple domains, including teaching, training, and operations. He is taking up the eligibility, scholarship, fee structure, and infrastructure part of the university. Before we proceed further in today's session, I would like to request everyone for any questions you can write in the chat box or in the Q&A box, or same will be addressed from my side in the end of this webinar. And now I hand over the thanks to Dr. Zaki Anwar, and it would be an absolute delight to listen from him. Over to you, Dr. Zaki Anwar.
Very good afternoon. All the panel members which has joined the session and the forthcoming students of our lovely professional university. I want to share my domain of the professional development which is being taken care of in the recent advances in the physiotherapy department has been launched worldwide. It was way back in 2024 when we have devised different sets of the technique in which we have mentioned the reference recent advances has to be taken care of when we are going into the panel discussions with the clinical investigation. So not wasting much time on the detailed part of it, I will go ahead with the different sets of the perspective segment of the treatment module which we are following during our persets of the treatment. So is coming part of the session, the different physiotherapy history, as I have mentioned. World War II, it was a devastating for the whole world. When the acknowledgement of physiotherapy first came into existence, two nursing staff of the England hospital, they came forward and they had followed a conceptual lab protocol in that hospital to rehabilitate those soldiers and the civilians got injured in World War. So that was the way back in which the history of physiotherapy came into existence. So the concept about the physiotherapy was in 460 BC, a physician Hippocrates who has given bit of the description part of physiotherapy. So as we had mentioned, it was in 19th century in which Great Britain has devised a physiotherapy. Second World War was the main benchmark that this profession came into existence, and their credibility to rehabilitate those injured, and it is going to one of the team members going to facilitate the medicine and surgery department along with the treatment part. Coming to the definition of physiotherapy, it is one of the science which can manage with the heat, light, electricity, and physical agents. And use of drug in the form of therapy is being avoided in sets of the treatment when we are treating a neonatal, the geriatric patients, and those focused patients has been involved with their specific diagnosis, treating techniques with the disease outcome, and the disability management by using the physical means. This is the total benchmark and the way of the treatment which we are giving. Coming to the specialty, orthopedic, neurology, cardiopulmonary, pediatric, geriatric, sports, rehab, these are the common sets of the treatment we are using it. For the different sets of the element as it is being notified, the preventive part will be the cervical spondylosis, frozen shoulder, sciatica, naming the few among the disease part. Role of the physiotherapist. Why this is important, why there is a need of PT intervention in certain sets of the disease. As along with the medicine, we know that it is not the only enough or the benchmark through the it can prevent the specific part of the ailment and having a proper diagnosis and the better outcome measure after the treatment protocol. We are as one of the adjunct treatment. And in many of the part of the diseases, we are at the only source of the treatment for the strength building and rehabilitating back the patient to the activity of daily living. So it is not only the mobility strength building, it is about the sets of the treatment for the different musculoskeletal disease and treatment, including the gait and posture balance mechanism. Coming to the different methods used in physiotherapy, as we know, the worldwide few of the common treatments is being already known to the general population worldwide. One is the shortwave diathermy, another is the microwave, followed by ultrasound interferential therapy. TENS is the transcutaneous electrical nerve, Faradic currents and galvanic. These are the naming few, including laser and Russian current therapy. These are the recent sets of the treatment we are using for the multiple ligament and knee injuries. Coming to the different exercise therapy component is the one of the adjunct part of the different allied treatment part in physiotherapy. We are using active passive movement, resistance exercises, joint mobilization, suspension therapy, hydrotherapy, relaxation techniques, and proprioceptive neurofacilitation techniques. These are among the whole sets of the treatment, and these are among the few sets of the treatment which I need to say which we are using it, but it will also get rehabilitated with other sets of the evidence-based practice as we are using those techniques for the gait and balance in the stroke patients as well. Coming to the shortwave diathermy, as I will not into go to the depth part, it has got at least a 3 meters benchmark treatment aspect with another equipment as it comes under the high frequency current. So it also mobilizes the skin tissues and refreshment of those specific areas of the element where the pain persists. So it is one of the part of the treatment. It's followed by macrodiathermy. It is the same component of the specific part of the high frequency current we are using for the certain ailments of the disease. Naming a few is the frozen shoulder, then rehabilitation of the fibromyalgia, followed by arthritis and hip anomalies as well. Ultrasound, this is one of the adjunct therapy we are using for the edematous part, tennis elbow, golfer's elbow, naming a few among the sports injury patients, including day-to-day treatment among the people who are suffering in the society. So this is a specific part we are treating along with the interferential therapy. This is one of the component we are using as an electrode placement, comes in the medium frequency current. This is a specific part of the treatment is it has got no invasive effect on the body or human body we are treating as a whole. So it is one of the specific adjunct part. Many of the populations get benefited with the treatment after the use of an IFT. TENS is a specific part we are using when the pain symptom is not at depth level, it is at a superficial level, and there is a specific fibromyalgia. We are using TENS treatment as an adjunct. Some in the neurological condition, some in the incontinence problem, some in the post-surgical pain, which has happened due to the generic effect of the surgery which is being implemented on the patient for the disease treatment. Coming to the different electrical muscle stimulator part, we are using it again for the specific sets of the treatment where there is a nerve degeneration. We are using it, and this also going to help in regeneration of the nerve, which a normal medicine part doesn't help much the patients who are suffering from nerve degeneration. Followed by cervical and lumbar traction. This is one of the specific part when there is a spinal and musculoskeletal dysfunction. This is specific part we are using in cases of the cervical spondylosis, lumbar spondylolithiasis, and certain treatment part when there is a laminectomy and disc herniation treatment has been done to the patient. This traction does make a difference to the treatment for the early rehabilitation. Paraffin wax bath is one of the specific, again, a heat treatment, infrared. This comes about another part of the superficial treatment part to increase the vascularity and immune system in the human body. As we are coming to the now laser, we have different variations of laser since the early intervention of laser came from class 1A to class 4A laser we are using, which can treat the tendon and ligament after the post-traumatic injury, either on field, either RTA injuries, either in hospital, any sets of the ligament repair or reconstructive surgeries. This has got very good effect. Russian currents is one of the other adjunct treatment we are using for the contractures, soreness in the muscles, and which can experience less flexibility to increase the range of motion. Russian currents are also used. Certain treatment part we are also using as an exercise treatment for the shoulder, frozen shoulder, then part of the rotator cuff injuries, and sets of the treatment in cases of lack of range of motion in the shoulder. Followed by parallel bars we are using in the coordination and balance treatment, along with the early rehab of the stroke patients, we are using this. Staircase and climbing and wobble board we are using again in the balance, and to maintain the specific set of gait patterns on barefoot when they are walking on the particular labs, or either in the OPD or either in any facility setups. Suspension therapy is again one of the balance gait mechanism to improve the specific strength and orientation in the muscles after the post-trauma, after the hemiplegia and paraplegia patients. Quadriceps, tables and chair again among the physio ball. These are the other rehab techniques we are using in geriatric and pediatric patients who are suffering from the congenital anomalies. Followed by overhead pulleys, supinator exercises. These are the coordination finger exercises we are using. These are the few components of the exercises we are using in the treatment. Walking aids. These are specific part of the aids is an adjunct to the post-traumatic injury in the lower limb, upper limb extremities. We are using these walking aids to rehabilitate the patient in a better manner. This is going to support the patients with different needs they are having according to the specific era of the management. Coming to the different sports injury part, we have got direct injury, we have got soft tissue injuries, we have got acute sets of injury, which is being followed by the specific identity criteria diversification, in which we are devising the different sets of injury, whether it is limited to the tissue, whether it is limited to the heart tissue, or either to the bone level. So we are classifying those injury during the evaluation process. So coming to the aspects of the analysis, direct injury is one version where there is an external blow to the force component on a human body. It is an indirect injury when an internal force or stretching a ligament is sudden happen to the directional change by the external force. This is a type of indirect injury. Overuse injury is a repetitive activity which can be used and can be prevented if we are known about the condition that our muscles or tissue is going to get lengthened if we are using overuse syndrome or overstretched activity in the sports event. Common sports injuries, as we mentioned, at a tissue level, we are analyzing whether there is a contusion, strain, sprain, abrasion, or incision type of soft tissue injury during the post-operative care management. Bone injuries might be because of RTA, might be because of any external force generated on the bone, which can happen. Different classifications are there from green stick to simple fracture. Joint injuries coming to the dislocation of the lower jaw or the shoulder jaw or the dislocation of the hip joint among the joint injuries common. Most common injuries we are treating, these are the few sets of the condition: tennis elbow, golfer's elbow, rotator cuff injury, phone shoulder, tendinitis, and bursitis. Then runner's knee is one of the condition in which the two angle lag is there. The extension knee is not going to happen in cases of runner's knee. The patient is often caught short of pain and they are bailing down at a field even when they are allowed to run on the field. So it is one of the condition given for the runner. So it is known as runner's knee. Achilles tendonitis, foot ankle sprain, pulled hamstring commonly happened in footballers. Plantar fasciitis, tibial band syndrome, carpal tunnel syndrome, and lower back pain. These are the common diseases often seen in nowadays day-to-day scenario. Common head injuries. This is an other segmental condition where there is a head injury to a patient and the reconstructive surgery has been done. Shift in the condition of the contusions are there and their orientation and balance got disturbed. So we are treating to rehabilitate those patients by warm up, cool up, stretching, cross train activity, rest tight, use proper technique and improve posture and balance among the DMS techniques as well. Followed by sports injury rehabilitation. we are treating early stage rehab, mid stage rehab, and late stage rehab. The different segmental plan of phases has been treated, in which we are using those sets of the treatment in phases to better rehabilitate the patient. Pilots is one of the innovative techniques as a recent advances. We are treating the sports athletes. We are treating different sets of the some of the yoga mats to treat the condition to maintain the strength, stability, and flexibility among the patients. Followed by taping is one of the segmental caniso tape we are using for the rehabilitation of the muscles, ligament stress and strain, and immobilize the joint for better recovery and healing. Stretching part, we are using static, dynamic, PNF, and plastic and neural. These are the few components we are using in day-to-day advancement in the treatment techniques, different injuries patterns. These are the few sets of the patterns we are using in the popular plastic stretching exercises, which is going to rehabilitate not only the flexibility among the athlete, but also for a female or a male who had developed sets of the laxity or due to the stiffness or rigidity due to the post-trauma. We are using those techniques. Advancement in physiotherapy, few are the naming techniques is EMG, MCV technique, gait analyzers, balance and gait techniques, cupping and dry needling, few of the components which can be dealt in a long perspective, can be taught in a long perspective as well. So that's all from my side. Thank you, panel member, for listening patience. Thank you very much. Over to you.
Thank you so much, Dr. Zaki Anwar. Now I would request to the admission nominee, Mr. Pankaj Vij, to be on the screen. Over to you, Mr. Pankaj. Kindly stop sharing your screen, Dr. Zaki Anwar. Sir will join in 2 minutes. Mr. Pankaj, as admission nominee, will join in 2 minutes. Dr. Zaki Anwar, can we take questions? Mr. Pankaj will join in 2-3 minutes. So can we take questions to Dr. Zaki Anwar? Unmute yourself. Yes. Dr. Zaki, can you please stop sharing your screen first? Yes, sir. Adil is asking here, can you explain the common mechanism of injury that lead to adhesive and how understanding these mechanism can help in developing effective treatment strategies?
Sorry, in the midline, it had missed out. What is the starting part of the two sentences? It was missed out due to the voice error. Can you repeat in the initial?
Yes, I'm repeating the question. It's can you please explain the common mechanism of injury that lead to adhesive capsulates and how understanding these mechanism can help in developing effective treatment strategies?
Yeah, fine. Adhesive capsulitis is one of the common ailment, is also known as Freund's shoulder. It is being devised way back by one of the renowned researcher who Neil. He has given the concept of the adhesive capsulitis, and it has been categorized into 3 different phases. We are always checking with the evidences of the patient how long he is suffering from. Either he is suffering from 1 month, 2 months, 3 months, depending upon the element of the disease. We are categorizing the front shoulder into freezing, thawing, and stages. Those stages can be categorized and evidence-based practice can be used for better rehabilitation. In that, not only the medication, our PT treatment is going to help them. As I mentioned in the recent advances, class 4 laser has got drastic effect in the treatment of frozen shoulder, that is also known as one of the stiff shoulder, or you can say ailing shoulder, not to get treated with other sets of the teeth.
Thank you so much, sir. Akshay is asking here, what are the latest advancements in the management of adhesive capsulates and how do these new techniques compare to traditional methods in terms of efficiency and patient outcomes?
Yeah, coming to the most evidence-based practice, as we had mentioned, that part of the dry needling, the specific part of the class 4 laser with supervised exercises does make a difference. Not only a reconstructive surgery, which many of these surgeons usually prescribe, the reconstructive surgery, or they put a steroid in the joint and they manipulate the joint, which is going to give a very bad effect for the outcome of the treatment. That is a good prognosis of the treatment. That steroid is going to further derange the frozen shoulder. So never use, it's not been instructed that unless it's retired necessary, you should not use steroid in the joint unless you follow the best evidence-based practice, including the laser, dry needling, and supervised exercise for the treatment. Including we have got mentioned in the few of the sets of the mobilization technique. One of them is GD Metlin technique, which is being used to break down those adhesive fibers in spite of putting a steroid and manipulating the shoulder.
Thank you so much, sir. Mega is asking here, how do biomechanical factors contribute to the development of adhesive capsulates and what roles does the shoulder joint anatomy play in these injuries?
Yeah, it's a glenohumeral rhythm. As in the this capsulitis, the main factor part is the glenohumeral part, is an anatomical feature where the shoulder humerus head joints with the acetabulum. That is a specific part of the glenum part. So that scapular part along with the humerus part is going to role play in the several sets of the occupational treatment. Suppose there is a tennis player, is playing tennis for a couple of 10 years or 5 years, he may develop some of the disuse changes in the shoulder due to the repeated trauma to the glenohumeral segment of the joint. So that role play as a specific part from where the bone articulates with the cartilage is the segmental area. The biomechanical part is also known as one of the occupational part, what a patient role play in his day-to-day life does make a change, and we are contributing, asking the patient, what is your occupation, how long the symptom has started, when it started, how often you feel pain, and how often this pain got worsen in certain condition, gives the clinical diagnosis.
Thank you so much, Dr. Zaki. I hope all the participants got their answers from our expert, Dr. Zaki. So now I would request to the admission nominee, Mr. Pankaj Vij, to be on the screen. Over to you, Mr. Pankaj Vij.
Okay, good afternoon to everybody. And I would like to continue with the discussion that we had with Dr. And it was pertaining the physiotherapy program. So all the students interested in the physiotherapy program, it's a great field. And in order to tell you more about the university as such, the technical part has already been told by Dr. And as far as the things related to the university are concerned, I'm going to tell you about that particular thing. So allow me to just share my screen. Just give me a moment. Right. I hope my screen is visible to all.
Yes, screen is visible. You can continue, Mr. Pankaj.
Right, fine. So when a student comes to the university, when a student joins any particular program, what are the different things that he can expect to see in the university, or what are the things that he can or she can experience in the university? Number one, what are the kind of accreditations and the approvals that are with us? And these are the kind of accreditations and approvals are there that are there with the university. We are a NAC A++ graded university with a score of 3.68 on a scale of 4 points. So we are the best in Pan India across the various states of India. We are the best in terms of NAC gradation. Followed by NAC, we are also having an accreditation from the Council of Business Schools and Programs for the MBA or the management programs. Then we have got approval from the Indian Council for Agriculture Research, which is for the agriculture-oriented programs. Then we have got even got an approval for University Grants Commission, both for the regular programs and for distance education programs. We have got approval from National Council for Teacher Education for education-oriented programs, Pharmacy Council of India for pharmacy-oriented programs, Council of Architecture for architecture programs, Bar Council of India for law programs, Institute of Town Planners for planning-oriented program, and the point of discussion today, the Indian Association for Physiotherapists or of Physiotherapists. We got approval from such bodies that are displayed on your screen. We are also a member of the prestigious AIU, that is Association of Indian Universities, AICT, and so on and so forth. So these are kind of approvals and accreditations that are there with us. Followed by that, placements. Placements are yet another important aspect when it comes to placements. Well, placements is the last step in a student's career at a university or a college. So what you're seeing on your screen are our star students who have bagged packages as high as 3 crores, 50 lakhs, 48 lakhs, or so on and so forth, with companies such as Google, Amazon, and even biosciences and things like physiotherapy and so on and so forth. So we have got an array of students who have bagged really marvelous packages all across the various departments. Then followed by extracurricular activities. Any university or any college should have extracurricular activities in ample amount with them. And we also have extracurricular activities with us. And following is the kind of exposure that we provide to you in terms of extracurricular activities. Quite recently, we had the Khelo India University Games, which culminated, and we bagged the second position overall in India. Followed by that, you'll be glad to know that Neeraj Chopra, the likes of Bajrang Punia, the likes of Manpreet Singh, the former captain of the Indian hockey team, they are our own students. And the year was 2019, and we hosted the 106th edition of the Indian Science Congress, which was inaugurated by none other than the Prime Minister of India, Shri Narendra Modi ji. We had His Holiness the Dalai Lama a few years back, and he distributed degrees at a convocation ceremony. Then we had 2 former presidents of India and Afghanistan sharing the same stage and giving away degrees in yet another convocation ceremony. We had Shri Arun Jaitley ji, the late Finance Minister of India, who came to the campus a few years back and inaugurated a startup school. In 2018, we had the then Vice President of India, Shri Venkaiah Naidu ji, who participated, who rather distributed degrees to the students in the convocation ceremony that year. Then not only these kind of personalities, but intellects such as Gauhar Gopal Das also throng the campus, and they give live sermons to the teachers, to the students, to the parents. Yes, these people also throng the campus, not only to sing and dance, but also to interact with our students, because this is the kind of exposure that we believe in giving to our students. Followed by that, infrastructure. Yet another important vertical of academics is infrastructure. What you're seeing on a screen right now is a marvel of a building, 14 blocks joined back to back, housing the central library of the university, and also quite a few departments. And at the onset, we have got an open air theater where students perform theatrical events, nukkad nataks, and so on and so forth. That's our auditorium. That's our indoor auditorium, and it's got a capacity of 2,500 people in a single go. Then this is the laboratory that you're seeing on your screen. It's a computer lab that you're seeing on the screen, and we got a whole lot of them. Every department has its own kind of laboratory present with it. Followed by that, this is the glimpse of the central library that we have got at the campus, and it's a fully automated library that we have got. At the heart of the campus, it's a 600-acre campus that we have got, and it's situated on National Highway number 44. And on the National Highway number 44, we have got the 600-acre campus, and at the middle of the campus, We have got a mall, and let me take you inside the mall. These are the interiors of the mall. It's got Providence stores where students can purchase their stuff. It's got gymnasiums where students can exercise. It's got recreational facilities such as bowling alleys and so on and so forth. God forbid any student falls ill, but if a student falls ill, we are ready with a hospital within the university campus. It's a 25-bed hospital with resident doctors, medical staff, sports staff, and the consultancy or the counseling is absolutely free of cost. The student only needs to pay for the pharmacy or the medicines that the student buys. We even have a physiotherapy clinic in the university. So if for things related to physiotherapy, the student can also visit the physiotherapy clinic in the university. That's our outdoor theater, and all the outdoor events happen over here. That's a panoramic view of the university as such. We are a very clean and a very green university. A few years back, we were awarded as one of the cleanest universities in India. And talking about sports facilities, we have got some of the best sports facilities within the university. We have got an indoor sports complex. And what you're seeing on your screen is the Olympic-sized swimming pool that we have got. And we have got shooting ranges. You name a court, you get it: badminton, basketball, volleyball, and so on and so forth. We even have a squash court for the students who want to play squash. So that's the aerial view of the sports complex that we have within the 600-acre campus at LPU. Then talking about the hostel facility, people who are from far-flung areas, we have got students from all the states of India. And obviously, people coming from far-flung areas, they need hostel and residential facilities. We have got hostel and residential facilities with us. And at a single point of time, more than 22,000 students can put up in the hostel facility in the campus. The boys and the girls hostels are absolutely separate, but yes, they are all in the same campus. It's in the 600-acre campus that we have got all the hostel facility and everything. The hostel is a completely ragging-free campus, and it's manned by a strong contingent of 200 security guards around the clock, 24/7. So it's a very secure, safe place for the students to study and to develop and to grow. So that was about what you can expect when you come to the university, or what a student can expect when he or she comes to the university. Let me take you live, and let me just show you as to how you can find out the eligibility of a program, or can find out the fee structures and so on and so forth. Dalvinda ma'am, if students have any questions, they can ask, or I'll go for a demo.
Yes, sir. Yes, sir. Someone is asking here, how are the placements done in LPU, and what's the process? You are not audible, Mr. Pankaj.
I guess I'm audible now.
Yes, you're audible now. You can continue.
Okay, great. So talking about placements, well, placements are of prime importance to us. And placements play a very important part in a student's career. Obviously, admissions is the stepping stone, and what do you call placements are the last step. I guess Dr. must have spoken about the placements in his discussion. But as far as placements is concerned, I'll just share a very brief and a very simple way of explaining how placements work, or what are the prerequisites for a placements. For placements, all the student needs to take care of is that a student during his or her academics should have a good academic score. They should possess a good academic score. And apart from getting a good academic score, the student should have a fine or a very good subject knowledge. If a student has got good academic scores and has good subject knowledge, then the third step would be speaking out his mind. During your interviews or during your GDs or something like that, people will ask you, people will try to gauge as to what exactly is your knowledge. So if these three things are in a single line, that is good marks, good subject knowledge, and your communication skills, not only about speaking English, but your communication skills in terms of speaking up your knowledge or speaking up your mind, then placements is not a tough nut to crack. If you can achieve these three things, then placements are easy to come by. Moving on, I guess my screen is visible to all now.
Yes, sir, you can continue.
Great. So how to find out the eligibility or fee structures or so on and so forth of a specific program? You need to go to lpu.in, go to admissions, and then go to after 12th. Let's say I want to find out the eligibility for BPT, Bachelor's of Physiotherapy program. So I go to lpu.in, I go to admissions, I go to after 12th, regular programs. In regular programs, I will search for my core discipline, which is physiotherapy, and I'll select physiotherapy, and I'll get to know about the eligibility and the fee structure and everything with regards to physiotherapy. The page is loading up, but you just need to log into lpu.in, and in lpu.in, you just need to go after 12th programs, and after 12th programs, let me try it once again. Just give me a moment. Right. There we go. That's our website. I go to admissions, after 12th, regular programs, and in regular programs, it'll show me the various disciplines. I guess it's not displaying as of now, but not an issue. This is the path that you can follow. And once you follow this particular path, you'll get to know that various disciplines will start to display over here. And you can select your discipline, which is physiotherapy. And once the physiotherapy appears, you can click that particular thing and you can get to know the eligibility, you can get to know the fee structures, you can get to know the various aspects of the program. I'll try to reload the page once again. Dalvinder ma'am, if you have any questions or students have any other questions, they can ask, or I'll try to reload the page once again. Dalvinder ma'am, if students have any questions, you can go ahead and ask her or me, or I will just upload the page once again. It's not opening up. Some must be some technical issue.
Yes.
Just give me a moment.
Yes, take your
If
time.
any questions, you can ask in the meanwhile.
Yes. Let me check. Dr. Zaki already answered all the questions. Mr. Pankaj will share the screen in a while. Unmute yourself, Mr. Pankaj, yes.
I'm saying that the students can obviously call us on our helpline numbers and get to know about the eligibility, about the fee structures and everything. I'm almost there. Right. Just give me a moment. Yes, finally we are there. Okay, I guess my screen is visible to all.
Yes, sir, visible.
Fine. So once I've clicked the regular programs, I get to the next page and you see physiotherapy over here. So I select physiotherapy from here and it goes to the Bachelor's of Physiotherapy program, 4.5 years, 9 semesters. I click it on the Bachelor's of Physiotherapy program and it goes to the next page where I can just scroll down a little bit and get to know the eligibility of the program. The eligibility of the program is passed with 60% marks in aggregate in 12th with English, physics, chemistry, or biology, or equivalent subject to qualifying LP Nest or CUET. So any student who's got 60% marks in his or her 12th standard and has studied PCB is eligible for the program with English, obviously, and the student has to appear for either CUET, the student must have cleared CUET, or if it is not CUET, then no problems, the student can appear for our exam, which is LPUNES, Lovely Professional University National Entrance and Scholarship Test. So that's the prerequisite, that's the eligibility criteria. The student wants to know about the fee structure, you can just go over here, click over here, and the page takes you to the fee structure. The fee structure of the program is 80,000 per semester. And if a student has got 80 to 89.99 in 12, or is in the cutoff 3 of our LP Nest exam, there's a 25% scholarship. Fee goes down to 60,000. Similarly, if a student has 90 to 94.99% of marks, there's a scholarship of 30%. Similarly, category 3, same scholarship, either this or this, 30% scholarship. Fee goes down to 56,000. And if a student has 95% or above, or is in the cutoff 1 of our LPNS exam, there's a 35% scholarship and the fee goes down to 52,000 per semester. So that's the kind of scholarship on the basis of marks and LPNS. There are other scholarships as well. The student can click over here and on the scholarship tab and get to know the scholarships. So scholarships are there on the basis of 12th marks, on the basis of LPNS. We have seen them. A student has got good scores in CUET. The student can avail scholarship on the basis of that as well. Precise details are over here. On the basis of NEET exam, there's a scholarship. The precise details are over here. Similarly, there are other scholarships as well. What are the other scholarships? Let's see. The other scholarships are somebody is into innovation, startups, or entrepreneurship. Such a student is also facilitated with scholarships. And if certain student has done good in sports, culture, or extracurricular activities, such student is also in for a scholarship. Somebody is a board topper. Such a student also gets scholarship. And last but not the least, anybody who is from an economically humble background can apply for a need-based scholarship. Somebody's father or mother is working with the defense forces. There's scholarships for such students as well. And last but not the least, God forbid any student is an orphan or a disabled child, such a student also can apply scholarships on the basis of being a parentless child or a disabled child. So these are the gambit of scholarships, or these are the array of scholarships that we are offering to our students. A student can obviously take a screenshot of this slide, this page. These are our helpline numbers, 01824404404, or a student can obviously write to us for general queries, info@lpu.co.in, or you can put in your admission queries on admissions@lpu.co.in. So these are our helpline numbers. You can obviously call us or write to us for your queries. I guess that's all from my side. I hope the information provided by me is of use to the students. Back to you, ma'am.
Thank you so much, Mr. Pankaj Vijayan. Once again, thanks to our experts, Dr. Zaki Anwar. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision-making regarding admission. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.